This is a good day for NHS staff who will benefit from this pay rise, an extra over £5,000 for a band 6 nurse or paramedic or midwife. So it's a good day for NHS staff, but it's also a good day for patients. It will allow us to move forward. Now the NHS Staff Council has ratified this deal. It's been accepted by the majority of the NHS Staff Council, and we can now move forward, focus together on patients, and also ensure that staff get the pay rise much sooner than would have been the case under the pay review body process.
There are some unions who aren't particularly happy about this, which means strikes will probably keep going. Are you going to get back round the negotiating table, or is this the final offer?
Well, it is the final offer, and it's important that those unions recognise the collective decision. This was a decision taken by 14 health unions. They reached a majority decision. It was negotiated collectively. The RCN were at the negotiating table. Indeed, Pat Cullen recommended this deal to her own members. So it's important that everyone now respects the decision of the NHS Staff Council. It's an opportunity to now come together. There's further areas where we can work collaboratively in terms of some of the non-pay issues that we discussed during the negotiations. So I'm looking forward to working with trade union colleagues on those issues. But it's a good day for NHS staff. It's a good day for patients. An opportunity now to get that pay into staff's pay packets next month and for everyone to move forward together.
Now, this obviously doesn't include junior doctors. You're meeting with them later. They're far from happy. Do you think you'll get closer to offering them the 35% pay rise that they're looking for?
Well, I think what the deal with the Staff Council shows is the willingness of the government to enter into meaningful, constructive negotiations with trade unions. That's what we've done with the Agenda for Change staff, covering more than 1 million NHS workers. We've also listened to doctors in terms of pension changes. That was a key demand, particularly of many consultants, that we make changes to pensions, and the Chancellor did that in the budget. So we've shown that we're willing to engage constructively in meaningful conversations. That's reflected in the really positive decision today by the NHS Staff Council, and I hope we can take that into the discussions with the junior doctors who are meeting later today.
You worked in number 10. Have you got confidence in Simon Case, and are you concerned about what's happened around Sue Gray's appointment, potentially as Labour's Chief of Staff?
Yes, I do have confidence in the Cabinet Secretary, and it's important that ministers and senior civil servants work constructively together. I'm sure that's the case in number 10. It was when I was there.
Health Secretary, you'll appreciate I have to ask you about this, but there have been claims of bullying around your behaviour in this department. We were told that you didn't know anything about those claims that came out. Since those reports, have you spoken to staff around here to get a feeling for why that may have happened?
Well, no complaints were raised with me, but again, it's important that we work constructively together. I hugely value that the work officials within the department do, and indeed over the course of the weekend, ministers and senior officials were working very closely together, both in terms of the Staff Council decision that we've agreed today, but also in terms of Sudan and some medics that were in Sudan and other mitigations in the context of the RCN strike. So we're working constructively together. That's what I'm focused on, and we've got an extremely positive announcement with the Staff Council decision. That's an opportunity now for the NHS to move forward. More than 1 million staff will get a pay rise. Band 6 nurses, over £5,000 for the 2 years. So it's a very positive day for staff. It's also a positive day for patients.
One very quick one. Should the families who were impacted by the hormone pregnancy test Primadose get compensation? Theresa May and Andy Burnham have both backed it.
Well, there is a court case on that, so it's important that one allows the legal process to follow its course. So you wouldn't expect ministers to comment on issues that are before the court. But Baroness Cumberledge obviously made a series of recommendations. We've been working our way through to implement those. We've been taking her report extremely seriously. But where there's a court case, it's important that that is allowed to go before the judiciary and follow the normal course.